Welcome to The Explainer. Today, we are diving deep, literally, into the world of aquatic therapy. We're going to explore how occupational therapists are using the unique properties of water to help children reach their biggest functional goals.
You know, this one simple question really gets to the heart of what we're talking about today. For so many kids, especially those with motor difficulties, therapy can be tough. But what happens when you take that work and put it in the water? Well, it transforms into this supportive, engaging playground where making progress can almost feel effortless. So, let's start with the core challenge here. Kids with motor difficulties can get caught in this really tough negative cycle. Because movement is hard, they might participate less in physical activities, and that can lead to feeling left out, maybe some social isolation, and of course, a decline in their physical health. This isn't just about missing out on fun, it's a pattern that can have some serious long-term consequences. Okay, so in this explainer, here's what we've got lined up. First, we'll talk about why an intervention like this is so needed. Then we'll get into the nitty-gritty of how water actually works its magic. After that, we'll look at what a major review of the research says, compare aquatic therapy head-to-head with land-based methods, and finally, wrap it all up with how this translates from the pool into everyday clinical practice.
All right, let's dive right in. Why is finding therapy that's not just effective, but also super engaging, so absolutely critical for these kids?
This chart, this really tells the story. See the red dots? Those represent kids with probable developmental coordination disorder, or DCD. The blue dots are kids with typical development. Just look at how the red dots are consistently shifted to the right. That means significantly higher BMI and body fat. And here's the crucial part. The research found this wasn't about diet. It was almost entirely due to lower levels of physical activity. That's the cycle we're trying to break.
So how can we help these kids break out of that cycle? Well, this is where the incredible properties of water come into play. Let's talk about how things like buoyancy, resistance, and even warmth can be harnessed to create a uniquely powerful therapeutic space. Now you might be wondering, what exactly is aquatic therapy? It's definitely not just about swimming lessons. Think of it as a skilled, purposeful intervention that therapists use to work on very specific functional goals. The water's buoyancy, for example, kind of reduces the pull of gravity, making it way easier for a child to practice their balance for standing. Or the water's natural resistance can provide amazing sensory feedback to help coordinate the movements they need for everyday tasks. Therapists have a whole toolbox of evidence-based techniques to structure their sessions. You can see a few of the big ones listed here, but the one you see pop up again and again in pediatric research is the Holligmic method. The Holligmic method is this really brilliant, highly structured 10-point program, and it's broken down into these 4 phases. It's a perfect example of motor learning in action. It starts with just getting comfortable, and then it progressively builds a child's confidence and postural control, taking them from simply learning to balance while floating all the way to mastering controlled, independent movement through the water. It's pretty amazing. Okay, so that all sounds great in theory, right? But what does the research actually tell us about how effective programs like these are? Does it really work?
Well, to get a really clear picture of the evidence, we can look at this key systematic review from 2013. Basically, researchers gathered up 17 different studies on kids with a whole range of conditions, from cerebral palsy and autism to DCD, to see what all that data said when you put it together.
And wow, the findings were really compelling. As you can see from this table, aquatic therapy led to statistically significant improvements pretty much across the board. The biggest jumps were in gross motor function, things like running and jumping, and in gait parameters, which is just a technical way of saying how a child walks. So we're talking about real-world improvements in fundamental movement skills.
But here's the part that really matters. These gains weren't just temporary. In about 60% of the studies, those improvements were still there when researchers followed up later on. This tells us that the skills they learn in the pool are actually sticking and translating into lasting changes on land. That's huge.
Now, of course, while the results are super positive, we always have to look at the science with a critical eye. The overall quality of the evidence was rated as moderate. The good news is that the study methods were detailed and the patient groups were similar. But there were also weaknesses, like small sample sizes and a lack of blinding, which means there's some potential for bias.
Okay, so this brings us to a really important question for any therapist or parent who's weighing their options. This all sounds great, but how does aquatic therapy actually stack up against the traditional land-based stuff we're all more familiar with?
Well, a recent study was designed to answer that exact question. Researchers took a group of kids with DCD and split them into 3 groups. One got aquatic therapy, one got land-based therapy, and a control group got no intervention at all. and they tracked everyone's motor performance before the program started, right after it ended, and then again 6 months down the road.
So let's look at the results, because this is fascinating. Just focus on those two groups on the right. The green is aquatic therapy, and the teal is land-based. You can see that clear jump in their scores from the first bar to the second. And look, that improvement holds steady in the third bar 6 months later. Now, glance over at the control group on the left. Pretty much no change.
This right here perfectly illustrates the study's main conclusion, and it's such a powerful takeaway for practice. It's not really about which one is better. What the evidence shows is that both aquatic and land-based therapies are effective, and, crucially, those benefits are built to last.
So after all that, what does this actually mean for occupational therapists and other practitioners who are trying to support real, functional, participation-based goals for the kids they work with?
Okay, so here's the bottom line. Aquatic therapy is a powerful, evidence-based tool. It's not just a fun activity. For a child who really struggles with balance on land, the pool's supportive environment might be the very thing that allows them to practice standing and reaching, skills they need to get dressed all by themselves. The gains are real, they are durable, and they directly help a child participate more fully in their daily life. Ultimately, all of this evidence really leaves us with this big, forward-looking question. Knowing that we have these incredible tools at our disposal, the challenge for all of us, therapists, parents, educators, is to think creatively. How can we best integrate these different environments to help every single child participate more fully, more confidently, and honestly, more joyfully in their world?